Welcome back to Medic Talk, everyone. Today we're going deep on a condition that can really throw the body for a loop.
Hyperthyroidism.
Ooh, yeah.
It's all about that little butterfly-shaped gland in your neck. The thyroid and what happens when it goes into overdrive.
Yeah.
For future healthcare pros, like you listening in, this is one you'll want to have a solid grasp on.
Yeah, for sure.
Because it can mimic so many other conditions,
Right.
making diagnosis a real challenge.
You're absolutely right. Hyperthyroidism, it's a bit of a chameleon in the clinic.
Yeah.
And to really understand why it's so tricky, we need to start with the basics, thyroid hormones.
All right, let's break it down. What are we even talking about when we say thyroid hormones?
So essentially, the thyroid gland, it produces two main hormones,
Right.
T3 and T4. They act like messengers telling your body's cells how much energy to burn.
Yeah.
They control your metabolism. Now, in hyperthyroidism, the thyroid, it goes into overdrive, pumping out way too much T3 and T4.
So like hitting the gas pedal on your metabolism.
Exactly. It's like flooring it.
Everything's speeding up.
Yeah. But how common is this whole overdrive issue?
Thankfully, it's not super common. Only about 1.3% of people in the U.S. have it.
Okay.
But here's the thing. Those excess hormones, they have a ripple effect throughout the entire body, leading to a whole cascade of symptoms.
Okay, now that's what I'm really curious about, how this metabolic overdrive actually shows up in a patient. What kind of symptoms should we be on the lookout for?
So imagine this. A patient comes in complaining of unexplained weight loss.
Okay.
Even though they haven't changed their diet or exercise habits.
Interesting.
Their heart is racing like they just ran a marathon.
Wow.
They're constantly feeling hot and sweaty, even in a cool room.
Okay.
They're struggling to sleep, their hands are trembling, and they're feeling anxious and irritable all the time.
That sounds like a lot to deal with.
It is. It can be really debilitating.
Wow. So one tiny gland going haywire can really wreak havoc
Oh, absolutely.
on a person's life.
Yeah.
That racing heart, is that literally because the body's working overtime to keep up with this like amped up metabolism?
Exactly. It's like the body's engine is revving at top speed all the time.
Yeah.
And those seemingly subtle symptoms, they can be incredibly disruptive to daily life. Just imagine trying to focus at work or school when your heart feels like it's going to beat out of your chest.
Yeah, no kidding.
Yeah.
It's amazing how interconnected everything is.
Yeah.
So what's causing the thyroid to go rogue in the first place? What are the usual suspects behind all this hormonal chaos?
Well, in the majority of cases, it's an autoimmune condition called Graves' disease.
Okay.
Think of it like this. The body's immune system, which normally protects us, mistakenly attacks the thyroid gland, causing it to go into overdrive.
So the body's fighting itself, basically.
Yeah, in a way.
Yeah.
And genetics play a role here, too. If you have a family history of Graves' disease, your chances of developing it increase.
Graves' disease, got it. That seems like a big one to remember.
Yeah.
But you mentioned other potential culprits too, right?
Right. There are a few other things that can throw the thyroid off balance. Sometimes small lumps or nodules can develop in the thyroid. And these nodules can start producing extra hormones leading to hyperthyroidism. Then there's thyroiditis.
Thyroiditis.
Yeah, an inflammation of the thyroid,
Okay.
which can also cause temporary surge in hormone production. And believe it or not, even consuming too much iodine can be a trigger.
Hold on, too much iodine. So like loading up on seaweed salad can mess with my thyroid.
It's all about the dosage. While unlikely, it's possible to get too much iodine from certain foods or even medications.
Okay.
For example, some heart medications and the contrast dye used in certain imaging scans contain high amounts of iodine, and that can sometimes trigger hyperthyroidism.
Interesting. So we've got this lineup of potential culprits, each with their own way of disrupting the thyroid's delicate balance.
Yeah,
I imagine this is where having a really solid diagnostic strategy is critical.
it is.
How do doctors connect the dots and figure out what's really going on?
So the first step is a thorough physical exam. Doctors will be looking for those telltale signs: an enlarged thyroid gland,
Okay.
that characteristic rapid heartbeat, moist skin, and even subtle tremors. It's all about picking up on those clues that point to a thyroid issue.
So those classic clinical signs can really guide the investigation.
Absolutely.
But I'm guessing it goes beyond just a physical exam, right? What about blood tests?
Oh, blood tests are essential. They can measure the levels of those key thyroid hormones, T3 and T4,
Okay.
giving us a clear picture of what's going on. And here's where it gets interesting. The blood test can also measure TSH, or thyroid stimulating hormone.
TSH. Now, that's one I haven't quite wrapped my head around yet.
Okay.
What's its role in all of this?
Think of TSH like the conductor of an orchestra.
Okay.
When thyroid hormone levels are low, TSH tells the thyroid to produce more.
Got it.
But in hyperthyroidism, the orchestra is playing too loud. There's too much T3 and T4.
Right.
So the conductor, TSH, tries to quiet them down, but the musicians, the thyroid gland, they aren't listening.
Okay, I love that analogy. So in hyperthyroidism, we'd expect to see high T3 and T4 levels, but low TSH.
Right.
Because the body's trying to rein in that overactive thyroid.
Exactly. And if those blood tests point to hyperthyroidism, we might then turn to imaging tests, like a radioactive iodine uptake scan or a thyroid ultrasound.
Okay.
These can help us visualize the thyroid gland,
Yeah.
look for nodules, and get a better understanding of what's driving the overproduction of hormones.
It sounds like a really multifaceted approach.
Yeah.
Piecing together the puzzle with the physical exam, the blood work, the imaging.
It is. It's like detective work.
It's fascinating to see how each piece contributes to the diagnosis.
Absolutely.
And once we've identified the cause of the hyperthyroidism, then comes the crucial question: how do we treat it?
That's the next step.
I'm ready to dive into that. What's in the toolkit for managing this thyroid troublemaker?
Let's explore those treatment options.
Let's do it when we come back in part 2.
Sounds good. Welcome back.
All right, so we've unmasked the hyperthyroidism culprit.
Yeah.
Now, how do we tackle it? I'm guessing there's no one-size-fits-all treatment plan here.
You're exactly right. The approach really depends on, what's causing the hyperthyroidism and each patient's individual circumstances.
Of course, makes sense.
But let's explore some of the most common strategies.
Yeah, let's do it. Walk us through the treatment options.
So often the first line of defense is antithyroid medication.
Okay.
Think methimazole or propylthiouracil.
Mm-hmm.
These medications, they work by essentially blocking the thyroid's ability to produce, churn out those excess hormones.
So it's like putting a gentle brake on that overactive thyroid.
Exactly.
How long does it usually take for these medications to, bring things back into balance?
Typically, we start seeing the thyroid function normalizing within a couple of months, sometimes even sooner. And the relief from those bothersome symptoms might start even earlier within a few weeks.
Oh, wow. That's reassuring to hear.
Yeah.
But are these medications like a long-term solution, or do we need to consider other options down the line?
Sometimes medication is all that's needed, especially if the hyperthyroidism is temporary.
Right.
But for more persistent cases, we might consider radioactive iodine therapy.
Radioactive iodine therapy. That's one I've always been curious about. Can you break down how that works?
It's a pretty ingenious approach, actually. The patient takes a dose of radioactive iodine, which is like a homing beacon for thyroid cells.
Okay.
It gets absorbed specifically by the thyroid, and then the radioactive iodine atoms release energy that destroys those overactive cells.
Oh, wow. So it's like a targeted missile taking out those troublesome thyroid cells with precision.
Exactly.
But what happens to the thyroid gland itself after this treatment?
In most cases, the treatment results in permanent destruction of the thyroid.
Oh, wow.
So it's essentially a cure for the hyperthyroidism.
Okay.
But the trade-off is that the patient will likely need to take thyroid hormone replacement medication for life.
So we're swapping hyperthyroidism for hypothyroidism, its counterpart, and managing that with medication. Interesting trade-off. Now, besides medication and radioactive iodine, are there any other treatment options on the table?
We do have surgery as a possibility, a thyroidectomy where all or part of the thyroid gland is removed.
Okay.
This option usually comes into play if medications aren't working, or if there are large nodules, or if there are concerns about cancer.
A thyroidectomy, that sounds like a pretty significant decision.
It is. And similar to radioactive iodine treatment, it usually results in hypothyroidism and the need for lifelong thyroid hormone replacement therapy.
Got it. So it seems like those are the heavy hitters in our arsenal medication, radioactive iodine and surgery.
Yeah.
But what about managing those uncomfortable symptoms while we're waiting for the treatment to take effect?
Yeah,
Are there any strategies for getting those under control quickly?
absolutely. Beta blockers are great for that.
Okay.
They don't directly address the hormone levels, but they're excellent at controlling those racing heartbeats, tremors, and anxiety that often accompany hyperthyroidism.
So symptom relief is a key part of the plan, too.
Yeah.
It seems like no matter which path we choose, close collaboration between the patient and their healthcare provider is really paramount.
Absolutely. Couldn't agree more. Finding the best strategy for each individual is critical.
Yeah.
Now let's shift our focus to the long-term outlook for individuals with hyperthyroidism.
Okay.
With proper management, it's a condition they can live with, right?
That's what I'm hoping to hear. Paint a picture of the prognosis for us.
The good news is that with the right treatment and management, most people with hyperthyroidism can absolutely live normal, healthy lives.
Okay, that's good.
But, and this is a big but, it's
Oh.
crucial to address it early on. Left untreated, hyperthyroidism can have some pretty serious consequences.
Okay, let's talk about those consequences. What
Yeah.
kind of complications are we talking about here?
We'll think heart problems like atrial fibrillation, where the heart rhythm gets all out of whack, or even heart failure. Then there's the risk of osteoporosis, where the bones become weak and brittle. Vision problems, particularly if Graves' disease is involved, and even complications during pregnancy.
Wow, that's a sobering reminder that this tiny gland can have a big impact.
It can
You mentioned pregnancy. Are there any unique considerations for women with hyperthyroidism who are expecting?
Pregnancy definitely adds another layer of complexity.
Okay,
While a slight increase in thyroid hormones is normal during pregnancy, if we see more dramatic fluctuations, it needs careful monitoring and management.
makes sense.
Lucky.
It's a delicate balance to maintain. Now, I know diet can sometimes play a role in thyroid health.
Right.
Are there any specific dietary recommendations for people dealing with hyperthyroidism?
It's true that what we eat can influence thyroid function. Iodine in particular can have an impact.
Okay.
But the dietary advice really needs to be tailored to the individual and the underlying cause of their hyperthyroidism.
So working with a registered dietitian or a knowledgeable healthcare provider is key. No self-prescribing crazy diets.
Absolutely. Personalized advice is essential. Now, before we wrap up, there's one more topic I want to make sure we touch on.
Okay.
It's a rare but serious complication of hyperthyroidism called thyroid storm.
Thyroid storm. That sounds pretty intense. What exactly is it, and what should we be looking out for?
Thyroid storm is basically hyperthyroidism on overdrive. It's a life-threatening condition where the thyroid goes haywire, flooding the body with massive amounts of hormones. It can be triggered by various things: infections, surgery, even untreated hyperthyroidism itself.
So it's like hyperthyroidism and overdrive, a true medical emergency.
Exactly. And recognizing the signs is crucial. Think high fever, a heart rate that's through the roof, and even mental status changes like confusion or agitation.
Got it.
This is a 9/11 situation, no question.
It's a stark reminder that even though hyperthyroidism is manageable, early diagnosis and proper treatment are absolutely vital.
Absolutely.
Now, before we send our listeners off to check their pulse and sweat levels, let's summarize the key takeaways from this deep dive.
Sounds good to me. Back to you.
All right, Medic Talk listeners, let's recap what we've learned about hyperthyroidism today.
Yeah, it's a fascinating condition, right?
It is. So we covered a lot of ground, from those telltale symptoms, like a racing heart, unexplained weight loss, to the underlying causes,
Right.
like Graves' disease, and even the potential complications if it's left untreated.
Yeah, it's important to catch it early.
It is. It's
Yeah.
all about connecting the dots,
Right.
recognizing those subtle clues that could point to a thyroid issue,
Right.
and understanding how those excess hormones can impact, various systems in the body.
Yeah, the ripple effect.
Exactly.
Yeah,
And remember, early detection is key.
absolutely.
If you're experiencing any of those symptoms we discussed, don't hesitate to talk to your doctor. Get those thyroid levels checked.
Couldn't agree more.
It's always better to err on the side of caution.
Right.
Right. Now, we talked about a range of treatment options.
We did.
From medications that gently curb hormone production to radioactive iodine therapy that targets those overactive thyroid cells, and even surgery in certain cases.
Yeah, a lot of tools in the toolkit.
A lot of tools. The key takeaway here is that treatment is highly effective,
It is.
but it's a collaborative process. Working closely with your healthcare provider to figure out the best approach for you is crucial.
Yeah, finding that right fit.
It's exactly.
Personalized care is the cornerstone of effective management. Now, before we sign off, I want to circle back to something we briefly touched upon: the ethical considerations surrounding radioactive iodine therapy.
Right. Good.
It's an important point to ponder. While it's often a successful treatment for hyperthyroidism, it usually leads to the need for lifelong thyroid hormone replacement.
Right.
So it raises the question, when is it appropriate to choose a treatment that essentially creates a new lifelong medical need?
Yeah, that's a tough one. It's something to really think about.
It's a complex issue with no easy answers. But it's something for all of us future healthcare professionals to consider, weighing the benefits and risks of each treatment option, considering the individual patient's circumstances and preferences. These are the hallmarks of ethical and patient-centered care.
Absolutely. Empowering patients to make informed decisions.
Exactly. And that starts with understanding the complexities of conditions like hyperthyroidism.
For sure.
Well, we hope this deep dive has given you a solid foundation for recognizing, managing, and navigating the challenges of hyperthyroidism. Yeah, we covered a lot.
We did. As always, we encourage you to explore the show notes for additional resources and links.
And be sure to subscribe to Medic Talk for more in-depth explorations of the fascinating world of medicine.
Thanks for joining us on this journey into the world of the thyroid.
See you next time.
Until next time, stay curious and keep learning.